Welcome and hello. I'd like to present to you today a short course on bioidentical hormones and how they can be used to really help maximize your vitality, your strength, your emotional state, and really work as a preventive measure that you can take to help yourself get through the peri and menopausal years and protect yourself from some of the things that occur as your hormones decline. Now, what are bioidentical hormones? Bioidentical hormones are hormones that are identical in every way, shape, form, structure to the hormones that normally exist in your body. When we're talking about bioidentical hormones, we're basically talking about estrogen, progesterone, DHEA, cortisol, a growth hormone, and testosterone. There's a lot of others, but those are the general ones we're talking about as being bioidentical hormones. Now, what we like to do, and we're basically specifically talking about how women can do this, but it also applies to men, because men have the same hormones, by the way, is that you've heard a lot about bioidentical hormones. Suzanne Somers wrote 2 books called Ageless and The Sexy Years. Both those books brought bioidentical hormones into the media limelight. And there's been a lot of talk back and forth as to are they good, are they not good. That's why I'm producing this here today, so that I can give you a brief summary and overview that you can understand. So bioidentical hormones are produced in a laboratory. Generally they're produced from soy base or wild yam base, and they are identical to the hormones that we have currently in our body. Now, how do they differ from, for example, synthetic hormones like Premarin, like Provera, like Prempro? Well, synthetic hormones, what happens is they have to be synthesized in a laboratory and they cannot look bioidentical. In other words, they can't be patented if they're the same things that exist in nature. So that's why they have to be produced synthetically. Now, Premarin, for example, are hormones that are produced from the urine of a pregnant mare horse. So they extract from the urine of the pregnant horse the hormones. Now the problem with this is that not only do you have some female hormones, about 3 of them, but you have almost 80 other hormones that are not bioidentical, and they're actually known as equine horse estrogens. And as far as I'm concerned, these should never have been, nor should they ever be placed into the body of a woman. It's just wrong. And of course, with the Women's Health Initiative studies, where all this information came out on hormones being bad, actually, it was because they were using equine estrogens and not bioidentical. So it really did a big disservice to women, because it scared a lot of women away from potential therapies that can really help out. So basically, bioidentical versus synthetic is that bioidentical is what's in your body. It's what's always been in your body. Synthetic means that these hormones are not anything like what are naturally in your body, and therefore are synthetic and are patentable by the pharmaceutical companies, and that's why these are the things that are generally recommended to you by your traditional type primary general practice doctor. Now, for those of us who are more progressive physicians, what we do is we definitely use the bioidentical hormones and understand them. So I think what's really important is for you, all of you out there, to make sure to have a dialogue with your physicians as to the type of hormones and what you can use. Now, let's talk about some of the safety issues. Are bioidentical safe? Well, certainly according to some of the European studies, they actually have been shown to be safe. But one of the issues here, to be able to fully answer that question, is actually the fact that it's very difficult to have long-term studies on these substances because they can't be patented. So nobody can really make any money from it, and therefore nobody's willing to invest the money to do the studies. It's as simple as that. Now, what are the reasons that you might want to use bioidentical hormones? Well, this is the big one, and I can tell you right now, the main reason is to support you through the transitional years between the ages of 40 and 60, when your body's going to be changing. We know that estrogen is cardioprotective. It does protect the cardiovascular system. We know that estrogen maintains your bone mass. In other words, it protects your bones from dissolving away. We know that estrogens are protective for your brain and actually can reduce the incidence of Alzheimer's and cognitive decline. We know that progesterone is important for your bones. Progesterone is important for your emotional stability. For example, a lot of women will ask, boy, I'm just feeling out of sorts. I'm just not myself. And when you ask them certain questions like, are you anxious? Do you feel irritable? Do you sleep lightly and restlessly? Are your breasts tender before your period? Are your periods painful? Those are all signs of progesterone deficiency. So you can actually make a big difference using some simple progesterone that can actually help feed into estrogen metabolism and really help make a difference in a woman's body. Women also have testosterone. Testosterone is responsible for their bone mass and for their sense of well-being, for their libido, for their mental attitude, and for their muscular strength and lean body mass. So a lot of times you can actually help a woman along by using some simple progesterone and testosterone, transdermal creams. These are not orals, because when you take hormones orally, especially estrogens, you actually can run the risk of more risks of stroke and heart attack and liver problems, and that's why we use transdermal delivery, which are creams that you can just rub on your skin. They only last for a day in the body, so you can control your own dosing very easily. Simple to use, and really the risk is very minimal. One of the things that's important to me, you see, is cardiovascular disease risk prevention, cognitive maintenance. So that means, maintaining your mental function. So I don't like to hear my gals telling me that their memory's wilting, they can't remember things, they're forgetting where they put the key. So right away, that's a warning sign to me. At the same time, it's important to me maintain libido, to maintain bone mass, to maintain muscle strength. And so what I like to do, and you can all get ready and jot this down, is measure these hormones. You can ask your doctors to measure these hormones so at least you know where you are. In terms of women, if you're cycling with a menstrual period, what I like to do is get the numbers on day 19 to 21 of your cycle, counting the first day of bleed as day 1. So it's day 19 to 21 where the numbers are the best. So you just make sure to get your blood drawn then, or do your saliva test at that day time, day 19 to 21. And what we do is we ask for estradiol, progesterone, DHEA sulfate, total and free testosterone, and then if you want to see what your growth hormone levels are like, you can ask for insulin-like growth factor 1, or the abbreviation is IGF-1. Those would be the tests that you could request that would give you a good baseline as to where your hormones are and where you need to be. Traditionally speaking, most doctors will measure your FSH and your LH and will tell you you're either menopausal or you're not. That doesn't really help us, because if you've taken the birth control pill, if you've had to take certain medications, then what's going to happen is your hormones are going to be artificially lower. And people say, well, shouldn't we just age normally, gracefully? And I would say, yeah, in an ideal world, if we lived in the 1900s, yes. But in our environment now, we have things known as endocrine disruptors. And what these things do is they actually affect our endocrine system and lower our hormones more than they should be. So when I'm measuring people and I'm seeing these things going on, it's actually shocking to see how low people's hormones are. If I look, for example, at a 40-year-old woman who's been on the birth control pill for 10 years, during her lifetime, not necessarily 10 years prior to me testing her, her progesterone levels will be low almost 99% of the time. And so this is a problem. And we need to be on top of this, because as estrogen goes low, as progesterone goes low, not just the mood issues, not just the bloating issues, not just the feeling bad issues, feeling depressed issues, having no energy issues, having no libido issues, but more importantly, as estrogen declines, we have the increased risk of heart disease. We have the increased risk of atherosclerosis and the clogging of the arteries. We have the increased risk of osteoporosis, osteopenia, and the bones demineralizing and getting weak bones. We also have the risk of this weight gain that occurs with peri and menopausal years, where you notice women are getting heavier from about above the knees to below the breast, and that's because in the body's wisdom, the body knows it needs estrogen, and it produces fat, because fat can make estrogen. The problem is it makes the type of estrogen that causes more breast cancer, which is estrone, and that's an issue. So when looking at bioidentical hormones, there's a couple of things to keep in mind to summarize. One, they're identical in every way to the hormones you've always produced in your body. Identical. 2, when done correctly and measured and individualized, which is what we do at the clinic, every woman gets a baseline on her hormones. The prescriptions are tailored to her exact needs. When a woman comes in, we get the baseline, we get her on her personalized prescription, then in about 45 days we pull another sample, whether it's by saliva or blood, it doesn't matter. And what we do is we see how are we on those levels, because we want to tailor them. So basically we're testing almost every 3 months for the first year. And then once a woman is stabilized, probably she doesn't need a test but at every annual physical. So that's the difference. It's not one size fits all. A patch doesn't work for me because I can't tailor adjust the dosing. A pill certainly doesn't work for me when it comes to estrogen because, number one, I'm having the problems with the liver. I'm increasing cardio-CRP, which is a cardiovascular risk factor that I don't want to have increased in women, and oral hormones do this. And number three is I can't really control the dosing. So by doing this, we can really slow down bone loss. We can maintain the health of your skin, reducing fine lines, reducing wrinkles, preventing hair loss. Basically, we can maintain all these things as you're changing. Forget about, I didn't even talk about hot flashes because those are just symptoms of something going on inside. So for me, when a woman's having hot flashes, my concern is what's going on with the heart. What's going on with her bones? What's going on with her metabolism? So hot flashes, without saying, we're going to get rid of, and unfortunately that's what gets women into my office. When they leave, they understand the importance of what we're doing with our therapies. So bioidentical hormones can be a very, very, very powerful tool that you can utilize and employ to help yourself and really, as a preventive medicine protocol, add in a gentle, safe way. Remember, the philosophy is less is better. So whether it's less hormones, it's less medicines, it's less is better. So that's why we custom tailor it and try to use the least amount possible to really make an effect. Now, if you have any questions, you can give me a call at the clinic. We'll be happy to help you. I hope you found this informative and useful. Have a great day.